Okay, we've made it to our last slide set for volumes and plasma and protein binding. We're specifically talking about plasma protein binding. This last set of slides is about how we actually measure plasma protein binding. I just want to give you a sense of why it's so difficult, so you realize why it's more expensive and why we don't just use free concentration. And also, I spent 2 years of my life doing this, so it's sort of my area of expertise. So, how is protein binding determined? Specifically, plasma protein binding can be determined by equilibrium dialysis, ultrafiltration methods, or actually in vivo methods that your body does without you even thinking about it. So, I'm just going to quickly touch on these. Using equilibrium dialysis. So here, where's my little arrow? Okay, here. So this would be like a little cell, and I did this for many years, so I have lots of practice at this. So we'd put on this side of the dialysis unit would be a protein, like for example albumin, if the drug is bound to albumin, or maybe alpha-1 acetylglycoprotein. But the protein alone would be on this side. And on the buffer side, this would just be a buffer so that there'd be an equilibrium here, and we put spike drug in this, and then we put it in a water bath and let it shake for usually a couple of days and come to equilibrium, and there's like a membrane in between here. So only free drug can pass between these. And so only free drug will make it over to this buffer side. So if we measure the amount of drug on the buffer side and compare it to the drug on the protein side, we will get our fraction unbound. So that's one way of doing it. And it's really the gold standard. Although, like I said, it takes 2 days just to actually come to equilibrium. Sometimes longer. You have to actually do experiments to see how long it takes to come to equilibrium. So it's very time-consuming and labor-intensive. Ultrafiltration is a more common way to do it. It's a little bit faster. Here we have like a cell. Actually, these cells sometimes look a little bit like prescription bottles. And you put your protein... So you put your bound drug with protein, so your albumin, your blood, into this cell, and then there's a membrane here, and you use pressure to push only the free drug will go through, but you use pressure to push the drug through here, and only free drug will be here. So the concentration of drug in the ultrafiltrate, which is here, will be your unbound concentration. Finally, some in vivo methods. Only free drug will be able to move into your saliva because it would have to pass that membrane. And only free drug will move from your plasma inside a red blood cell. So people have used saliva to measure free concentrations. I tried to do that for about a year, which was really hard because anytime you drink something or eat something or chew gum, it changes the pH, which changes how much the drug moves. RBCs I did not try, but so these are some in vivo methods to measure free drug. Okay, so we're going to conclude this by again reminding of why we care about protein binding. Well, we care about protein binding because it's going to affect our volume and distribution, for one thing. It will also affect our clearance. I haven't talked about that yet, but you'll learn that in the next week of videos. But it is a determinant of VSS, isn't it? Fraction unbound in plasma and fraction unbound in tissue is what determines your volume and distribution at steady state. These things in turn also affect your K. So you can see that changes in protein binding are going to be very important in determining our dosing regimen adjustments. And also, the other thing that's really big about protein binding is it determines what percentage of your drug is active or not. If the drug is bound, a couple of things happen, right? First of all, it can't interact with the receptor to actually cause your pharmacologic action. It can't move around from compartment to compartment. It can't move from blood or plasma to tissues, right? It's stuck either in the tissues or the plasma if it's bound. It cannot be dialyzed if it's in the dialysis, if you have a drug that's dialyzed. What else? Those are the things I can think of right now. Okay, there's lots of things that happen when a drug is either bound or unbound, so it is very important. Okay, so I guess we talked about that. Cool. Thank you. That was a quick one. See you next time.